Hello everyone, I'm Dr. Sunaina Pamnani, a pediatric and preventive dentist practicing at Smile Isle Dental Care, North Bangalore, Karnataka. First, it is very important and imperial to determine whether the broken tooth is a baby tooth or it is an adult or a permanent tooth. If it's a broken baby tooth, look for any broken fragments in the child's mouth which can be hidden under the tongue or in the cheek area. We don't want the child to swallow the broken fragment. Then next step would be to take the child to the pediatric dentist and get it examined, because a loose tooth can pose certain serious complications also. Now, if the broken tooth is an adult or a permanent tooth, you need to keep the broken tooth fragment safely and you need to take it to your pediatric dentist, because in certain cases we can also reattach the broken tooth fragment instead of going ahead for any other procedures. A broken baby tooth can become an emergency if the broken tooth is very loosely attached in the gum and the fragments are separated or split but not fallen out. So the loose fragments pose a complication if there's always a risk that the child might ingest or aspirate the broken fragment. So it definitely becomes an emergency. Depending upon the level of the fracture, we can determine whether the crown can help us fix the baby tooth or no. Say suppose if the crown is broken only till the level of the gums and the fracture is not extending up until the root structure, we can save the baby's tooth by putting a crown or a cap, so to say. But if the fracture is extending beyond the gum line and it is extending up to the root, then we need to take x-rays and see and what is the best treatment option can be suggested. A broken baby tooth can definitely hurt permanently if it is neglected and the right treatment is not given at the correct time, because our teeth comprise of something called as a nerve, which is residing inside your root, in the root part of your teeth basically. So if the crown is fractured and it is fractured till the level of the pulp or the nerve, as commonly said, it can elicit a sharp shooting pain response whenever it is exposed to any stimuli like hot and cold water, or if your child is biting from the front teeth, and it can cause severe pain radiating to the jaw. Chewing is typically a sign that your child is getting a new tooth or they are exploring the world around them. So basically during this phase they tend to put whatever they find into their mouth. It could be anything, it could be a toy, it could be a piece of cloth, it could be their own fingers. They basically love to explore the world around them by doing so. But also in certain kids we have noticed that the chewing can become a habit, and it can be due to certain causes such as anxiety or highly stressful environments at school, or if they are very much focused on something. So you've seen a lot of people, they'll just nibble or bite the end of the pen or pencil when they are deeply engrossed in doing something. So highly focused children do have a habit of doing that, and it can also be just simply out of boredom or habit. So for avoiding your children from chewing onto things, for a very younger child, when the tooth is erupting, you can give them certain teethers which can help them soothe the pain while the tooth is erupting. For an older child, you can try positive reinforcements. Constant reminders can also play a crucial role in helping them eliminate the habit.